You've been referred to UCLH, so you can discuss your particular condition with one of our specialist consultants. And which hospital you have your surgery in will depend upon your condition. We have a strong team of consultant surgeons, anaesthetists and radiologists who work with the support of the specialist staff, including nurses, radiographers, surgical staff, therapists, dietitians, and pharmacists. When you come for the appointment, it could be useful to have someone with you. There can be a lot of information to take in, and another person can help remember all the details. Also, before your appointment, it can be helpful to make a list of the questions you want answered, and during the appointment you might like to take notes, just so you don't forget anything. Whatever your condition and situation, when your specialist consultant and their team have all the necessary information, they'll go through all of the treatment options and the risks and benefits with you. Together, you'll decide if surgery is the best treatment option for you, and if it is, you'll discuss when you come into hospital and how long you'll need to be with us for.
So what is the risk involved?
Well, all surgery does carry some risk, which is why it's important to discuss the alternatives, including doing nothing. But of course, doing nothing also carries some risk. In other words, that your symptoms will continue and may get worse, and the surgery is designed to improve those and your quality of life.
And how do you decide that the risk is an acceptable one?
What we have to do together is to weigh up the benefits of the operation against the risks. Our job is to keep the risks as low as possible, and therefore the balance is more dependent upon the degree of symptoms and therefore what you've got to gain from having the operation.
If you decide to go ahead with the surgery, the consultant or a member of their team will ask you to give your consent, and if relevant, you may be given information about your procedure and the risks and benefits. You'll be given a proposed date for your operation and an indication of your length of stay in hospital.